You know, referring physicians are really important for GYN cancers because they are on the forefront and they actually are detecting the problem, and then they'll send their patients to us. So I think it's important to have good lines of communication, a daily 8 to 5 presence of a physician who's willing to take a call. We can be contacted through the consultation center. We certainly have a very efficient scheduling system for referrals. We have a great team of surgeons who do robotic surgery, the majority of our division. And the way the robot works is the articulation of the arms in the abdomen allows us to do greater surgery, lose less blood, and it's really been wonderful for patients. They just stay overnight. Their recovery is quick as compared to the old-fashioned laparotomy, which we all can do. We were all trained to do that. But I'd say this has just revolutionized patients' lives. You're able to return to work. Mothers are able to return to taking care of their families. It's been phenomenal, the development of the robot and also the dedication of surgeons who really are committed to learning to make that robot work for patients. You know, GYN oncologists are devoted to GYN cancers, but certainly we can't be in a vacuum. We have a lot of colleagues who do important work. We have excellent surgeons. We have nationally known physicians with great reputations, so we can reach out and maybe access interesting and different treatments for our patients. So we have that networking going on for us. I think we're all really great at chemotherapy and we're all really nice people. I can't think of a single person in our group I wouldn't trust to operate on my mother or to whom I couldn't call in the middle of the night and say, what do you think I should do about this person? And in the long run, that really does help a patient to have a group where if you have to see someone's partner in the middle of the night, you know they're well taken care of. So we have physicians who are not only good physicians with patients, but have really creative minds. Dr. Bayjump is working on endometrial cancer, and specifically, what are some of the mechanisms whereby endometrial cancer occurs? Is it related to one's physique? Is obesity playing a role? And she's looking at the role of different drugs that we may use every day and seeing if she can exploit the use of that for endometrial cancer. So again, a different mechanism than the traditional cytotoxic chemotherapy that knocks you out. Dr. Gehrig is looking at a couple of different avenues for ovarian cancer. Specifically, she's working with the nanoparticle folks at Lineberger Cancer Center. Again, seeing which patients you may be able to select would be particularly responsive to various drugs. And they're working on a very unique approach to this with Dr. Bill Zamboni. Again, an example where UNC, in its foresight of choosing to develop nanoparticles, can combine that work with GYN cancers and lead to a really creative answer. I think another exciting area would be molecular profiling, and that is being applied already in breast cancer, and we're right behind them in the sense that can we look at a patient and decipher which patient's cancer will respond to which drug? That would really be the key. I think in lines of chemotherapy, that's probably one of the areas that's really important. Traditionally, when you give chemotherapy, it's a cytotoxic. So it knocks out your hair, your bone marrow, makes you feel sick. The way of the future is monoclonal antibodies, targeted therapy, really drugs that specifically target the mechanism of cancer, not just killing all cells at one time. And so we're in for a really great era of very exciting therapies. Clinical trials are really important for all cancers. It's an opportunity to bring new innovative therapies to a patient before they hit the market. And you know the way things go, it could be 5 years before it's available for a patient. So for example, if there's a new drug and the pharma company is interested in just running a clinical trial, offering it to our patients, we're all for it. So I think it's a great way to, really a reason to come to UNC for the clinical trials and a great way to give these patients an opportunity ahead of time. So what is the favorite part of my job? I do like taking care of patients. I think you really can help a patient on a daily basis, kind of get through that, kind of direct them, telling, again, when things are going well and when things are not going well, maybe to take care of their life and, really have a lot of engagement with your patients.